on here all right? Yes, good. You're all sitting at the back. Okay. What I want to talk about today was making data accessible to citizens and decision makers, and I actually would group decision makers, the senior decision makers in organisations, along with citizens in terms of the sort of their requirements in terms of data presentation, because they're very, very busy. It's not because they're not clever, they're very, very busy. They don't have time, they don't need to wade through loads of spreadsheets and all sorts of other things that typically are presented. So just a little bit of background about us, very, very quickly, who we work for and so on. We do some work for the NHS. This is a portal we built for them, which is about comparing workforce data. And within that are a series of tools for benchmarking around sickness absence, staff turnover, pay, that sort of thing. And also within there are tools actually for data collection. So we're using some data from the NHS and some data that we're collecting ourselves. We work for local authorities. This is a website designed for Sheffield City Council. And we do work for membership organisations. This is the Health and Social Care West Midlands site that we built for Improvement and Efficiency West Midlands, which has the brief to try and bring together health and social care in the region, and is also working on the implementation of the Social Care Act, which is all gearing up for April the 1st this year. And we're a publisher. We publish the information daily, and within that we have Healthcare Innovation Daily and also Data Daily, so publishing articles and so forth about this area. We also create content. This was published on Monday. It's about the sort of challenges and opportunities around IT and digital arising from the Health and Social Care Act 2012 and the Care Act 2014. Basically, there's a lot of information that's been published by health people for health people, and a lot of information that's been published by social care people for social care people. Not much that sort of jumbles it up, and yet that's the point of really of all the reforms. So that's what that publication is about. We're a communications company, essentially, so our data work is very communications-led. And we feel that data presentation should be communications-led, and it often isn't. So as far as we're concerned, tech for tech's sake, whizzy presentations, and particularly fussy infographics, which often don't really tell you anything, look lovely, but don't tell you anything, we believe should be avoided. So yes, keep it simple. Anyone that looks at Public Health England data a lot will be familiar with this type of presentation. They're changing obviously now, but what people have done here is really try and put loads and loads and loads of information and data into one tool, and that can be extremely confusing for people who don't deal with data a lot and people who are very short of time. They're moving away from this, as I said, and some of you may have seen this this infographic or heat map, if you like, of which is describing premature deaths. The message here is pretty obvious, which is sort of don't live in the north, or actually don't live in Birmingham either, or Coventry. But what was interesting about this is when it was published about 18 months ago, it made the headlines on the Today programme. And this was old data, it wasn't a news story, but the fact that it had been presented in such a clear and stark way interested the media, and they wanted to talk about it. And it was also interesting what the reactions of people who were data specialists to this publication was. And there were two main reactions. One of them was, well, surely everybody knows all this. That was sort of from public data professionals. And the answer is no, they don't. Most people don't know this. It has to be presented in this way for it to make an impact. The second reaction that people had, and this was particularly public health professionals, was the public isn't ready for this, which of course is absolute nonsense, because if, as politicians do, we are to take more responsibility for our own health and well-being, we have to have this information. So it's ridiculous to try and sort of, as it were, shield us from it in a kind of paternalistic way. But if we're going to share this information with the public, and I would say with decision makers, it has to be very clear and simple. Actually, this is just another point I wanted to make, that it's all very well looking at premature deaths, but actually healthy life expectancy is a far more shocking thing that we really need to get our heads around, and I wonder how many people really understand know these figures. Just to bring it down to some work that we're doing, at the moment we're doing a project, we're part of a consortium with Birmingham City Council, which is getting money from the Cabinet Office Open Data Fund, to start publishing, releasing open data and start publishing and visualizing open data. And we're the visualization end of the project. And this is the Birmingham area split up into wards. And what the colours are showing is the majority tenure of housing in each area. The dark bits that you'll see are where the majority tenure is outright ownership of property. And as you expect, in the north of Birmingham, which is around Sutton Coldfield, has quite a lot of majority tenure. It's a very well-off area. What's quite interesting about this map is that there are some other areas towards the middle of town which are deprived areas according to indices of deprivation and so forth. And yet in those areas there is a lot of outright ownership of property. Now, there are lots of reasons behind this, and I'm sure you're all thinking about what they are. The point about this is whenever I've shown this map, people have immediately started talking about it and getting animated and interested, and they want to know what it's about. So again, it's a single piece of information on a single screen, and that is engaging people because it is so simple. And I think this is the way to go. Also make it relevant. Now, again, this is more work from the Birmingham City Council Open Data Project. We met some people from the community, and what they wanted was two key things. One was, they said, look, there's all this public data around that is open data, but it doesn't go down to the level that we're interested in, which is sort of neighbourhood level. It's all done at ward level. Now, the little white boundaries that you can see, those are lower super output areas. So one of the things that we've done in this project is we're enabling people to click on the individual lower super output area where they live, and it'll light up in red and give them the data on the left-hand side there. So that's enabling them to see exactly where they live, what the data is. And obviously not all data is available at LSOA level, but what we're trying to do is to get the data available and accessible and easy to understand at that sort of neighbourhood level. The other thing that we were told was that that these community groups often collect a lot of data, but they struggle to present it to the authorities, and the authorities tend to sort of dismiss it and say, oh, well, you know, that's just data you've collected, it's not really significant. So they wanted a way to publish the data, to, as it were, sort of give it a bit more official status, because the minute it's published, people find it's more credible. So we're going to adapt something that we've already done. This is something we did about the location of neighbourhood plans. Neighbourhood planning is part of localism, a policy of this government. And if you live in a village or a neighbourhood, you can create a neighbourhood plan which is about the development that you want to see in your area. When I say you, I mean the community, and there's a whole process that they have to go through. And then it's adopted by the local authority. So we took some data from the Department of Communities, created this map and all the little areas where there are plans, but then enabled people to update that data themselves. So anybody, you can find this on the internet, I'll show it to you if you want, can find this on the internet, register on the site and say, actually, I know that information isn't right, I'll change that, or we're interested in starting a neighbourhood plan in our area, so I'm going to put down a marker there and tell other people that that's what we're doing. So you can go on there and you just fill in a little form on the web, and hey presto, your information is published immediately. So our community people that are participating in the Birmingham project on open data, this is the sort of thing they want, so that they can put their data on a map. They can send out people in their groups and crowdsource information that's useful to the community. The Department for Communities on Neighbourhood Planning, what it's doing to collect its data is it's going to every single local authority website and scraping off those websites data about who's doing a plan in the different areas. And then it's creating a map on paper, essentially, which is showing how many neighbourhood plans are going on in local authority areas. And the dark bits on the map up there are the bits where there's lots going on. So, you know, Herefordshire, Cornwall, whatever, they're doing really well on neighbourhood planning. Now, that information is of interest to Department of Communities, but it's not of interest to the citizen. What the citizen wants to know is where is neighbourhood planning going on, so that I can go and ask those people how to do my neighbourhood plan, because I want to do one and I'm quite near. So I'm nearly at the end. So this is really my message, which is that government organisations should actually make the data itself more available and usable to developers like us, so that we can do interesting and useful stuff with the data. And very quickly, last slide, this is something that we've done for the HSN about patient safety data, and if anyone's interested to know more about that project, I would be delighted to tell them.